areas involved in language processing. So we have another area that is known as primary auditory cortex. You can see here primary auditory cortex. It receives signals from the ear via auditory nerves. It receives signal from the ears, right, through auditory nerve. It analyzes basic feature of sound like pitch, high or low sound, volume, loud or soft, rhythm, tone. Then this information is passed to other area of the brain for more complex processing like understanding and speech, music. Right, so this is okay where something begins. If this part is damaged, okay, so then your further parts of the brain will not function to understand and to produce speech. Examples: your ear catch the sound. That signal travels through the nerves to the primary auditory cortex. And this area helps you recognize the sound as a voice and its basic features. Other brain organs help you understand what was said and who said it. So in order to comprehend something, okay, for comprehension, this part is also very much important, because here the waves enter in your through your ears to your mind. Right? Somebody says something through your ear, it enters in the mind, and then from the mind it travels to other parts of the brain to produce something or to comprehend something. Examples: damage to the Broca's area lead to difficulty in forming sentences. If this part of your brain is damaged, you will have problems in what? Difficulties in what? Forming sentences. This is called Broca's area. A Broca's area is damaged due to stroke or due to some injuries. You will have problem in forming sentences. Okay? You can see here Weronika's model here, that primary motor cortex is here, and here we have acute facialis, and here we have Broca's area. Here we have primary auditory cortex. Here we have angular gyrus, primary visual cortex, and Weronika's area. This is Weronika's area. Quick fact about Broca's aphasia. Now, what is Broca's aphasia? Located in the motor cortex of the left hemisphere and critical for language production and speaking and writing. That's Broca's area. So Broca's aphasia occurs when there is damage to Broca's area. So when there is damage to Broca's area, so you will have Broca's aphasia, often due to a stroke or traumatic brain injury. So non-fluent speech, you will be non-fluent in speech because use of short sentences can be hard to think of words and difficulty with grammar. And strengthening in comprehension, typically easier to understand speech, understand speech than produce. So you will understand the speech, but you will be unable to produce, because the problem that is in Broca's area, Broca's aphasia, the problem is not Weronika's aphasia. How the brain processes language. Hearing words, the auditory cortex process sound, as we talked about. Here we have auditory cortex. We talked about here primary auditory cortex. So it says that hearing words, the auditory cortex processes sound, and then we have understanding, meaning, Weronika's area deciphers meanings. So then Weronika's area is responsible because once the sounds hear through the ear. And then producing speech, Broca's areas organize speech production. If you want to say something, then Broca's area is responsible for that. And reading and writing, so then we have visual cortex, and angular gyrus helps decode symbols. This part is responsible to decode, to read and write something. Language disorder aphasia. Aphasia, a language disorder caused by brain damage often due to stroke. The three main types of aphasia. One is called Broca's aphasia, one is called Weronika's aphasia, and one is called Global's aphasia. So the three main types of aphasia which involve trouble speaking, writing, or understanding language includes, these are the three types of aphasia. Problems. If these are damaged, you will have problems. Now, aphasia happens when a part of the brain associated with language, like the frontal lobe, the temporal lobe, or the parietal lobe, is damaged. So, and one of the part is damaged, so then you will have problem in understanding, in production, okay, or listening or something. So it is most common after a stroke, but it can also be caused by a traumatic brain injury, a brain tumor, or infections of the brain. Less common types of aphasia also exist. Less common types of aphasia also exist. Now you can see here, if you have problem with aphasia, you're suffering from aphasia, so you will have trouble in speaking clearly. This will be what type of aphasia? Broca's aphasia. Trouble speaking clearly. Trouble understanding speech, you will have Weronika's aphasia. Trouble writing, you will have Angular's gyrus aphasia. And trouble understanding writing words, again the same one. And trouble remembering words, and similarly troubling remembering object names. Symptoms of aphasia, if you have suffering from aphasia, so the symptoms can be that trouble speaking clearly, trouble understanding speech, trouble writing clearly, and trouble understanding written words, and trouble remembering words, and trouble remembering object names. Aphasia, you can see here different types of aphasia, and difficulty speaking, difficulty writing, difficulty reading, and difficulty understanding. Now the first one, that is Broca's aphasia. Broca's aphasia, difficulty speaking but comprehension remains intact. Comprehension is fine. If this part is damaged, Broca's, so comprehension will be fine. You will have problem in speaking. For example, you can understand, or you want to say that I want an apple. You have this in mind, but you can't say it. You can't produce. You will say a, apple. So you'll have problem to produce sentences. You will use some phrases, okay, broken words, not complete one. Now, Weronika's aphasia, fluent. You will be able to speak fluently, but nonsensical speech with poor comprehensions. But you will not understand. You will have problem with understanding. For example, I want an apple. You will be able to say this, but you will can't understand. You won't comprehend. Marble, ya, bean, I, him, right? You will say something nonsensical that won't be understandable for you, right? Global aphasia. You probably can say, I want an apple, okay? But marble is I read or graphic. So global aphasia, severe impairments in both speaking and understanding. So global aphasia, when you have issues and problem with both, right? In speaking also and understanding also. You want an apple, you can't say it. You want an apple, you can't comprehend if somebody says something to you. So global aphasia consists of both these issues, Broca's and Weronika's. Example, that a stroke patient struggles to form sentences but understand them. Now, foreign accent syndrome, that is called FAS, F-A-S, a rare disorder where individuals develop a foreign sounding accent. A rare disorder often occurs after brain injury, strokes, or neurological condition. So you adopt a foreign accent because of this stroke. Speech patterns change due to alterations in motor controls. Example that a British woman starts speaking with a French-like accent after a stroke. You will adopt a foreign accent because of this stroke. Case studies in neurolinguistics. So, Finis gauge brain injury affected decision making and speech. And Sarah Scott, a teenager with Broca's aphasia, recognized speech ability. Right? And foreign accent syndromes cases, multiple documented cases worldwide. And stroke survivors' language rehabilitation studies show brain plasticity. Now, brain plasticity and language recovery. You can recover if you're suffering from Broca's or Wernika's damage or problems issue in early age. So the brain can recognize and comprehend for damaged areas. Speech therapy and cognitive exercise help language recovery. Younger brain recover faster due to the higher plasticity. Example that a stroke patients regain speech through therapy or neutral adaptation. Conclusion: language processing is a complex function involving multiple brain regions. Neurolinguistics help us understand speech disorders and their treatment. Ongoing research explores brain plasticity and AI applications in speech recovery. So this is okay. Conclusion: this was a comprehensive lecture on the relationship between language and brain, and what are the parts which are responsible for language production, language comprehension, and further we talked about how we remember words. We talked about that how auditory cortex involves in the start when the sounds enter in your ear and then enter in your mind. If you have any questions, so please feel free and ask your question in comment section. So in next lecture, we will discuss some more interesting lecture that will be relevant to psycholinguistics or sociolinguistics or forensic linguistics. Thank you so much.